happening. Look, this is not a complicated issue. Our healthcare system is disintegrating. We need real healthcare reform. The estimate is that over a 10-year period, that reform is going to cost something like $800 billion to $1 trillion. Where is the money going to come from? In the House, our colleagues there have done the right thing. And what they have said is that at a time when the middle class in this country is collapsing, when unemployment is horrendously high, we are not going to raise taxes on working people in order to pay for health care reform. And what they have said is, after years of Bush tax cuts for the richest people in this country, we're going to ask the wealthiest people to start paying a modest amount more so that we can bring tens and tens of millions of people into health insurance in this country. Poll after poll shows that the American people think it is right to ask the wealthiest people in this country to pay a little bit more. It is wrong to ask the middle class and working families to pay more in these difficult times. That's what this issue is about. House has done the right thing. Senate has done the wrong thing. I've got an amendment in to emulate what is taking place in the House, and we're going to fight as hard as we can to see that wins.
In the House, joined by 187 other colleagues in the House Democratic Caucus, we presented to Speaker Pelosi during the months of September, October, and November our point of view, which, as Senator Sanders said, is supported by the American people, namely that we should not tax health benefits, we should not tax the middle class to finance this effort. There, I think, is now a large and growing body of evidence that the proponents' claims that this is somehow going to result in bending the cost curve, that it's going to result in higher wages, is suspect at best.
Great to be here with the leadership of the AFL-CIO, the National Education Association, the steelworkers, the Teamsters. We're a united front on this. This is very simple. You can't make those who pay more.
We are here to say today, health care reform, yes, but no taxation on the workers. We need health care reform now, but we cannot afford to tax workers.
My name's Jim Huber. I work in a steel plant that's about 40 miles from here. I've been there for 42 years. We fought 50 years ago. Our union went on fight to get health care. We've fought every time we've gone to contract to keep that health care.
Say no to an excise tax on health care benefits. This is a penalty tax on working Americans. NEA members are teachers and school nurses, cafeteria workers, bus drivers, librarians, custodians. We work in America's public schools, colleges, and universities every day.
I support health care reform, but I cannot afford this health care tax. For families like mine that's on a budget, the results will be devastating. I urge the Senate to drop the tax on working families and middle-class families and pass a health care that is work for all of us.